really change quite a bit. And it's like a keystone. This is like the thoracics and where they transition into the lower thoracics, and you can see that how this is, everybody see that? You got the spinuses and then the short little spinous, and when you come down here there's a natural depression, and it's going to feel like an anterior segment, but it's not. So you have to just keep that in mind, that this is what's locking. You've got this thoracic spine, and what's holding that up is this one segment in here, and everything's wedging against that. Let's just go through the anatomy just briefly. You have 7 lumbars, okay, so, and it's not always 7, it's 6, and that's that way with the horse. Sometimes you see 7 lumbars on a horse. It's not often, but they do have a 7. And you have this orientation of the ilium where the joint is straight up and down. So when we go to adjust the PI, let's say this kicks back, this is fused here, they've got it glued together. But if this was going to roll back on this side, and in a dog you can have them, in the horse it works as one unit, like we talked about the steering wheel. With a dog, it independently articulates. So you can have this kick back, and you would be putting your thumb right on here. You're going to stabilize under the belly, and I'm going to demonstrate in a second, and it's going to be straight P to A. It's a fair amount of input. So my thumb would be here, and I use it this way. You can all make this little thing, your thumb and your, that you would be putting your, you can use it here, here, on directly on the spinuses. And you'll be doing that all the way up into the thoracics, except on these. We'll show you how to do these. But this little thing where your thumb and your knuckle are together are going to form this little wedge, and you can use this to drive. The impulse is about like that. It's brisk and it's quick. We watched yesterday a lot of speed in the adjustment. So when we're cycling, we're doing this, and we want to see this happening all the way to the thoracics. When it's hung up, as soon as this is subluxated on the SI joint or the 6th or 7th lumbar, that you're going to, as you cycle that, you're going to bump into this resistance. You're going to do this. This is going to move, so this is going to pivot, and as soon as you come back, if they're subluxated, the muscles contract, you're going to hit that. There'll be resistance there. So for now, a couple things to remember is that you've got 7 lumbars. You've got an SI joint that is straight up and down. You've got 6 lumbars on a lot of them. You don't have an intertransverse joint. You can look at these transverse processes, how they're shaped. On a horse, they go straight out like wings of an airplane. But on a dog, they're quite different, aren't they?
Yeah.
So anyway, you've got to keep in mind that you're on this very sensitive area here, and you've got to be careful in getting too far lateral that you can do some damage there. And we'll put that down.